Hi everybody, welcome to PD Nurse E-Corner. I am Mrs.Brammu, Assistant Professor at SNS College of Nursing. And here we are back again to meet each other by a new topic, which is ventricular tachycardia. So we all know what is tachy. Yes, anything or a heart rate more than maybe 100 beats per minute. So why we consider this ventricular tachycardia as an essential one, and how we nurses going to tackle this ventricular tachycardia. So ventricular tachycardia is always we would have heard in all the emergency rooms and ICUs that it is something it's a very lethal rhythm. Yes, of course. And then it is mostly a deadly rhythm. Might be patient is going into collapse, and also it is coming under the ACLS, that is the advanced cardiac life support. So how we the nurses are going to approach this ventricular tachycardia. So before going into ventricular tachycardia approach or the nursing management, so in this session of 5 minutes, I'm not going to waste your time, just we'll go into the depth of ventricular tachycardia. So you can see this, the normal sinus rhythm, which is nothing but the original PQRS complex, and you can see that the rhythm is very regular, as well as the RR interval is having equal RR interval with the PQRS and the T wave. In case of a ventricular tachycardia, you can see that there is no atrial activity, and only the ventricular rhythm, which is also very much chaotic in nature. So what is ventricular tachycardia? So usually when you analyze any rhythm, the three or the major complexity which you have to keep in mind is that the regularity. So as I told you in the previous slide, the RR interval or the P wave or the QRS complexes, whether they are usually regular or irregular. So in this ventricular tachycardia, the rhythm, that is the ventricular activity, is almost the same. Like you can see in this picture that the ventricular activity is taking at least a boxes of 2 big boxes on this before it is going to the other amplitude. And as we can see, the interval between the two, that is one wave and the other wave, is very close, which is taking less than a small single box, which shows that the patient is having a tachyrhythm. So the heart rate is approximately more than 150, I suppose, in this case. And as well, when you check in for the P wave, can you see the P wave? I'm not able to see any P wave over here. Yes, even you. So that if there is no P wave, then yes, we can come to a conclusion that it can be a ventricular tachycardia, which is a lethal rhythm. And here you can see the QRS complexes. That is, the duration of this complex is usually 0.12 seconds or more, and this is always in a like abnormal fashion, in a bizarre shaped thing. So what can be the major causes of this ventricular tachycardia? Is it going to happen for all the normal adults? No, of course. Might be in case of any hypoxic state, such as in case of any respiratory problem, or in case of multi-organ dysfunction, the patient can develop a ventricular tachycardia. And myocardial infarction, in case of hypokalemia or low magnesium level, in caffeine toxicity or any stimulants or stresses, can cause this ventricular tachycardia. So the most treatment of choice here is we have to go in for immediately the easy version, that is ventricular fibrillation. So coming into the depth knowledge of what is ventricular tachycardia. So when you analyze the picture which is shown on the above is the atrium, the heart, which is comprising of 2 atriums and 2 ventricles. And of course we all know the rhythm is nothing but the PQRS complexes. And here the P wave is being generated by the atrial depolarization. and the QRS complex is by the ventricular depolarization and ventricular repolarization. So this QRS complexes will show you a P and a QRS complex followed by another complex. So in case of a ventricular dysrhythms or dysrhythmias, you can see that either it can be in monomorphic or polymorphic modes of ventricular tachycardia. So now what can be the possible nursing management for a patient with ventricular tachycardia? Of course, as I told you, we have to go in for the ACLS protocol, that is the DZ version, or that is the DZ version. Here, yes, you will be going for PSVT, which is having premature ventricular tachycardia. And the drug of choice here used is that procainamide, amiodarone, lidocaine, and sotalol, which is a major beta blocker. And procainamide is a drug which is actually going to depress the myocardial contraction, and amiodarone is a drug which is going to increase or the action potentials, and thereby it is helping the sinoatrial node to contract and relax, and thereby releasing the conduction nodes through the accessory pathways. And here the lidocaine will be playing a major role in doing the suppressing of the ventricular cells, because here the heart is now having decreased atrial activity when compared to the ventricular activity. So in order to equalize that or to reduce the threshold of the ventricular activity, we can plan and choice of a drug such as lidocaine, and sotalol is always a beta adrenergic blockers, and this can be used in order to slow down the heart rate. So what can be the possible treatment of choice? The treatment of choice here is that it should be as of a SOP protocol. So just check in with the patient's hemodynamics. If the patient is unstable, then we have to plan in for either electrical defibrillation or cardioversion along with the ACLS protocols. And in case if the patient is going for this electrical storm with more than 3 episodes and within the first 24 hours, then the treatment of choice would be starting with the beta blocker, starting with an IV amiodarone, and starting with sedations in order to calm down the heart rate, as well as to make the rhythm more pacific or more in normal fashion. So we can plan in a choice of drugs, such as if it is a polymorphic VT, we are planning for either procainamide drug or amiodarone, or considering the beta blocker. In case of a monomorphic polymorphic VT, if the QT complex is regular, then what can be done? And if there is a long QT complex, which we call it as TORCD points, then we have to plan in for, along with the amiodarone drug, which is a along with that, you are also going to start with the drugs such as electrolytes such as magnesium, potassium, and we have to stop the offending agent if you are started with the offending agent. And keep in mind that we are going to start with antiarrhythmic drug, which is the cardron, or you call it as amiodarone. And in case of any pacing is being placed in the patient, we have to reduce the over pacing of that particular patient. So this is how we approach the patient for a patient with ventricular tachycardia. So see that the ACLS guidelines are also put forth when you are treating the patient. So what are the possible nursing interventions in ventricular tachycardia? Yes, it is a combine of both. That is, you're going to go with the medical interventions as well as certain interventions where the nurses at the emergency room or in the ICU, we do the defibrillation, directly connecting the patient to the defib and applying the paddles onto the patient's apex as well as the just below to the right clavicular bone. We place it and we'll be giving the defibrillation. So in case if you have any insights or if you want to learn about the defibrillation, please don't forget to put it onto the comment box where I can prepare on that, and we will be getting back to you on the what is the difference between a cardioversion and a defibrillation. Stay tuned to my channel. Please don't forget to subscribe and comment and pass on the video to your friends. Thank you.